Thank you again for having me, and I would like to thank HITLAB and anyone here for being here and then trying to attend what I'm trying to say. Again, yeah, the title has been announced already. So chronic conditions, right? We all know they affect a lot of population in the US, around the world as well. In the US, 6 in every 10 people, basically 60% of the population has one chronic condition, and then 40% have 2 or more chronic conditions. And it's affecting us deeply as well. I lost several family members, friends, and colleagues to chronic conditions, being in breast cancer, ovarian cancer, and heart disease. And the challenges are still there. And then when it comes to the challenges in chronic disease management from an imaging perspective, there are multiple of them. Like one of them is in rural areas, which we call the healthcare deserts. Access to imaging is limited and expensive. So we cannot really provide high quality care in these areas. For chronic disease monitoring, frequent monitoring of disease progression is not available currently. The monitoring is done once a year. Sometimes patients miss their appointments due to various reasons, and then that extends to 1.5 years or 2 years. That's very important for a chronic disease. A year is a long time. You can switch from a high-risk group to having diagnosed at a late-stage chronic condition at the hospital. Low patient compliance and engagement. Again, this goes back to the accessibility, affordability, and then the quality of services that are being provided. High cost of imaging, again, is another problem. And then all of these combined are leading to diagnostics that are often too late. And you're diagnosed at a late stage. Managing late stage chronic disease is very challenging, especially considering that a lot of these conditions, the disease advances to the surrounding tissue, and you have to deal with that additional problem as well. This is the slide we always talk about, and I'm doing as an academic person, when I talk with the clinician colleagues, as well as when we're talking as part of the PONS as well. A lot of data right now, as we know, is collected inside the hospital settings, especially I'm talking about imaging data. So we have imaging data from healthy people who do their regular checkups, or we have the imaging data of someone who's admitted to the hospital with some sort of pain in their body and diagnosed with late-stage chronic condition. What about the imaging data that is in between these 2 stages, which is the data on how the disease progresses from a healthy state to a diseased stage? We don't have that data because that data resides outside the hospital settings. And I'm talking about specifically people who are in the high-risk group of chronic conditions. In our case, PONS is focused on breast cancer. These are the patients who are in a high-risk group either due to a family member being diagnosed with breast cancer or they're having dense breast tissue. So these patients need to be monitored more frequently, and because the chronic condition that matters more frequently. And that data size is big as well. So we don't have a complete picture of a disease data in terms of imaging perspective. So how do we collect that? So this is one of the aims that we did, basically. And then the main technology that we're using, we're a software technology company. We're not designing the devices. They're called point-of-care ultrasound devices. These are different manufacturers. You're seeing here, we have our own manufacturing, we are outsourcing the manufacturing of our device, but Philips, GE has one, Clarius, and Butterfly as well. These are basically point-of-care ultrasound devices. You can connect to your cell phone or your tablet. You can perform imaging anywhere you go. And so far, the adaptation has been still limited, or not limited, but the early adaptation has been focused on using this technology still inside the hospital settings where traditional ultrasound, cart-based systems were not used. Emergency room was one of the main initial applications. But question becomes, can we take this very novel and very easy to, not easy to use, but like a sophisticated imaging technology outside the hospital settings and deploy it in various settings, right? It can be, our main goal is chronic disease, but you can use the technology for assessing injuries as well. Traumatic brain injury can be, for example, one of the application areas if you use an ocular ultrasound. So that was the question. Again, this slide again shows basically we have ultrasound is being used inside the hospital settings. We have expensive cart-based systems that have good imaging quality. We have point-of-care ultrasound systems. Anytime you shrink the imaging modality to a smaller size, you use from the imaging quality that are still being used and deployed inside the hospital settings. And outside the hospital settings is very limited. And especially providing or collecting data, high quality ultrasound data using point-of-care ultrasound devices outside the hospital settings is right now very limited. And that this is the opportunity gap that we're trying to solve. And this can be achieved by providing, by changing the image quality, by changing challenges of point-of-care ultrasound devices, by attacking them. So these are some of the challenges. The pros are there, right? Real-time, safe, portable. Device cost is smaller than card-based systems, but we see the challenges associated. There's many challenges. One of the main reasons is that data collection is manual. We have to move around the ultrasound probe that I showed. And that requires extensive training. You need to be trained for that many, many years to collect clinically acceptable, good quality data. If you move the probe a little bit, this image of video I'm showing is basically I'm scanning myself, but don't think I'm doing is basically tilting the probe from right to left. You can see how the image quality, the features are changing by that simple move. And you need to, when you're trying to basically bring this imaging modality outside the hospital settings to collect clinically acceptable data, so you can send that back to the clinicians for further investigation, that becomes a very challenging scenario to overcome. The second thing I mentioned is basically the low image quality. Ultrasound is very bad when you're trying to image very early stage disease. Because of that, focus has always been given to segmentation approaches where you can segment anatomy and do measurements and then try to correlate these measurements with the early stage disease. If it's late stage disease, ultrasound is pretty good actually. It shows late stage disease, very good. And you can do some image disease classification algorithms that tell you the staging of the disease. But early stage disease is very challenging. Limited data size is always something that we talk about, and especially when you're trying to collect data with point-of-care ultrasound devices, which has been a technology that has been out basically for the last 5-10 years. So this is basically the summary. Mobile ultrasound content is still not there for preventative care. Low image quality is still a challenge for imaging early stage disease, and limited medical imaging data on early stage disease prohibits the progress in AI for early stage disease monitoring. AI has been used. One of the nice application areas is the navigation of the untrained professional on the correct scan plane to correct clinically acceptable ultrasound data. These are companies that you see here. We have our own version where we use, designed for specifically outside the hospital use, that navigates the user to correct certain locations where you need to move the probe to collect clinically acceptable data. Once the data collection is complete, everything is sent back again to the provider. The radiologist can access it, they can look at that, they can share that data with the oncologist, right? So that is one of the aspects that we're working, as well as different companies are working as well. So what about the image quality improvement, right? This is one of the significant basic technologies we have in our company. As a company, we're offering this. And one of the nicer things about this technology is, and we're proud of that, it's not an AI-based solution. It's a sophisticated image processing method. So you don't require extensive data to train anything because it's not AI. What you can do is you can obtain from one single image 10, 15, or 20 different images. So you're improving the data set size from one single ultrasound image to 10 or 20 different of them. And here we're showing different basic enhancement results from the different anatomies, right? So it works with any kind of anatomy, with any kind of machine. And it gives you improved representation of the structures as well as early stage disease. So that's basically one of the advantages, or one of the things that we're providing as PONS as well. The additional thing, what else can we do? We basically have seen in the earlier talks that generative AI is moving into the field and it's transforming everything. Everybody is synthesizing different medical imaging modalities from text or from images. This is a study we did. Basically, our goal was, can we, the question was, can we generate something from an ultrasound image that is more effectively showing the structure underneath, right? And then this was basically synthesizing MRI images from ultrasound data. These are basically some of the earlier results. The target goal, this was like a clinical study done at the UBC. The target application area was prostate cancer because we had complementary imaging modalities of prostate and MRI and ultrasound, so we can train the algorithm. And these are some basic initial results. We have shown that the synthetic MRI you can see here It resembles the original MRI pretty good. But again, we also further, what we did is, it looks realistic, but is it really realistic? So we investigated the underlying radiomics features you can extract by well-known radiomics feature analysis methods, and we have seen that although the image quality of the generated images are very high, the radiomics features, we could only extract 60% of them. So it's not really, it's a good start, but are we there yet for this kind of method? We are not. But we're also generating from text different images. These are basically breast cancer images that we are showing here. We're using a text-based guidance input. We can basically increase the data size that we can train our algorithm. And again, these are some basically ultrasound images of the breast tissue. Imagine when we can collect data on early stage disease, we can train these AI solutions on data that is missing. All of the generative AI solutions cannot function well if we don't feed them or train them with real data. You always have to have real data. You always have to collect diverse data so that the AI algorithm runs from a diverse set of data sets that we are trying to achieve by collecting early stage disease data outside the hospital settings. These are some of the other results that we were interested as well. Well, what about the data that we can generate from a semantic map, which is basically a segmentation manually drawn by clinicians or radiologists, right? So here we have the ultrasound data available, echocardiography data. We have which we call the ground truth, original echo data. We have the labeled data available in the middle, and then some basically compared some of the state-of-the-art methods. What we can show is like our results are on the far left column here. And we can improve the boundaries of the heart chamber as well, as you can see here. So you can do some improvements. This is not really, again, the final outcome. You can incorporate additional information. You can bring in information from a high-end card-based system and then complement that with labeled information, text-based guidance, and improve the quality of point-of-care ultrasound tests. These are basically different settings or different research directions that we can incorporate by incorporating AI into the point-of-care ultrasound devices. The technology is moving fast. A lot of groups are currently investigating flexible array transducers as well, including UBC, USCD, and then the MIT groups that have investigated and tests. But again, like these are very promising technologies. The quality of the data from these flexible transducers is still not there. Some of the early results are very promising. And some groups are also incorporating telerobotics, basically manipulating the robotic arm attached ultrasound machine from a city center hospital, and then trying to incorporate that in rural areas, for example, which we call the healthcare deserts. Some technologies basic companies are looking into bringing augmented reality into the image acquisition setup as well. And again, these are some research directions that are coming off the academia, and then we are trying to incorporate that into our system as well. But the remaining challenges, again, we talked, some of the other presenters mentioned as well, privacy still stays a big concern, especially when you're trying to bring an imaging modality that is usually collected inside a very controlled environment, which is the hospitals, and you're trying to bring that and then collect imaging data outside hospital settings and moving in rural areas or neighborhoods. That's privacy and security still has to be investigated as well. Integration within the broader healthcare ecosystem is always problematic, as we mentioned as well, with any kind of AI solution. And then our solution is integrated into Epic system, but again, that needs to be further investigated as well. Health equity and accessibility, again, studying how to increase access to focus in underserved areas for marginalized populations is very important, because that's a lot of data from marginalized groups, underrepresented communities. It is missing for various reasons. And that also affects our understanding how the disease, chronic conditions such as breast cancer or liver disease, are progressing inside these communities. In Canada, we have a big, basically, initiative where we're trying to bring focus to indigenous communities, for example. Again, a huge problem, but also there's a lot of question marks there as well, because we don't really have an understanding how the disease progresses in minority populations. Yeah, I think this is my last slide. Thank you again for having me, and then, yeah, thanks again.